Hello everyone, welcome back to the channel. Today, I'll be talking about warning signs of bowel cancer, also known as colorectal cancer. Bowel cancer is the third most common type of cancer and the second deadliest. About 10% of cancer-related deaths are due to this type of tumor. I'll also discuss prevention, actions you can take to reduce your risks, habits you should adopt, and foods you should consume to avoid this disease. So, stay tuned until the end. But first, like this video, subscribe to the channel, and share it with your friends and family. Warning signs you should watch out for that might indicate something is wrong with your bowel. Changes in bowel habits. It's very important to know your bowel habits. Some people go to the bathroom right after breakfast, while others might go 2 or 3 times a day. Changes in bowel movements are common as we age, and by themselves, they aren't usually alarming. However, if these changes persist, consult a doctor. These changes vary from person to person and depend on the tumor's location, size, and stage. Your stool may change in consistency and color, and you may start going to the bathroom more frequently, or, in other cases, much less often. The key change is when someone starts having diarrhea unrelated to a virus, and it lasts more than a few days. Blood in the stool. This is why it's so important to pay attention to your stool. The large intestine is divided into several parts: the ascending colon, transverse colon, descending colon, sigmoid colon, rectum, and anus. The right side of the colon is larger, and stool here is more liquid because one of the colon's functions is to absorb water from the stool. If the tumor is on the right side, ascending colon, there may not be obstruction symptoms. However, the tumor may bleed more, causing anemia, or the stool may turn dark and tarry, known as melena, which has a very unpleasant odor. On the left side, the descending colon and sigmoid colon are smaller, and stool becomes more solid. Here, bleeding may be more intense, dripping into the toilet after a bowel movement or appearing on toilet paper when you wipe. This doesn't necessarily mean you have colon cancer, but it's always a good idea to consult your doctor. Abdominal pain. If you've never had abdominal pain and now start experiencing severe cramps that don't go away and keep coming back, or pain during bowel movements, especially when the tumor affects the rectum, seek medical help. These could be symptoms of bowel cancer. Fatigue and exhaustion. This type of fatigue isn't due to poor sleep. With bowel cancer, fatigue may be caused by hidden anemia. The tumor can bleed slowly, leading to anemia. One of the main causes of unexplained anemia is bowel cancer. Additionally, the tumor may deplete your nutrients, contributing to chronic exhaustion and fatigue. Don't ignore these symptoms. Abdominal bloating. This can be a common symptom of bowel cancer. A tumor may partially or completely block the bowel, leading to a buildup of gas and stool. It can also obstruct the passage of food and liquids, causing abdominal swelling. Many conditions can cause bloating and abdominal pain, but if these symptoms are unusual or recurring, it's best to consult a doctor. Unexplained weight loss. Weight loss from bowel cancer can occur for several reasons. The tumor may interfere with your ability to absorb nutrients and calories, acting like a parasite that absorbs everything inside. Feeling that your bowels are not completely emptied. You might go to the bathroom and still feel like something is stuck that won't come out, making you feel like you need to go again. This sensation of incomplete evacuation is a common symptom of bowel cancer. A tumor may partially or completely block the bowel, giving the impression that stool is present when it's actually the tumor. Many people with colon cancer don't show symptoms in the early stages of the disease. Colon cancer develops from certain polyps lining the colon's inner wall. If these mucosal cells mutate, they can turn into a colon tumor. Most polyps don't become cancerous, but over time, some can. It generally takes about 10 years for a tumor to become cancer if it's not detected and removed. How can you protect yourself from bowel cancer? Tip 1. Stay hydrated, especially with water. When you're well hydrated, your bowels function better. Tip 2. Eat fiber-rich foods, like fruits and vegetables, which also contain antioxidants. Fiber, like water, speeds up stool movement, reducing contact time with the intestinal lining. It also improves gut flora. Tip 3. Add natural anti-inflammatory spices and foods to your diet, like turmeric and cinnamon. Tip 4. Exercise regularly. Physical activity improves bowel function, regulates hormones like insulin and estrogen, reduces inflammation, helps maintain a healthy weight, and lowers stress, all of which help prevent cancer. Tip 5. Avoid alcohol and smoking. Tip 6. Get medical checkups. At a minimum, take a fecal occult blood test, which can detect blood traces in stool that aren't visible to the naked eye. If you're over 45 and at average risk, consider a colonoscopy. A colonoscopy is important because it can detect polyps before they become cancerous. Early detection improves your chances. When colon cancer is found in its early stages, it has a 90% cure rate. Early diagnosis significantly increases the chances of successful treatment and full recovery. Take care of your gut health and keep your body healthy. If you enjoyed the video, remember to share it so more people can learn about this topic. Subscribe to the channel, and see you in the next video. Thank you.